Distinguished guests, ladies and gentlemen, online viewers from around the world, welcome to join us at the webinar of Taiwan Medical Technologies, Joining Hands and Bringing Greater Health to Life with Indonesia. My name is Angela Liu, your MC for today's event. Today's event is jointly organized by TAITRA, Taiwan's foremost trade promotion organization, and Taiwan's Ministry of Health and Welfare. In today's program, we will be presenting to you some of the best healthcare solutions in Taiwan, not only for the disease treatment, but also for a better and healthier life. Today, we're very happy to have international buyers and friends joining us online. A very warm welcome to those of you watching from Indonesia and all parts of the world. To begin with, we would like to invite Executive Director of TAITRA, Ms. Rachel Wu, to give us the opening remarks. Let's now welcome Ms. Wu.
Ladies and gentlemen, good afternoon. To all our friends and partners watching online from Indonesia, thank you for being here today. It's a great honor to welcome everyone to attend the healthcare seminar. On behalf of Taiwan External Trade Development Council, TAITRA, I sincerely hope that all of you are safe and well as we fight in this global COVID-19 pandemic together. COVID-19 may restrain our physical interaction, but not impede our innovation and thought. Taiwan has one of the best medical care systems in the world. Currently, there are 13 hospitals and clinics in Taiwan that have received JCI accreditation. JCI is the medical evaluation with the highest credibility recognized by the global medical professions. Last year, there are more than 380,000 foreign patients came to Taiwan for medical service, of which 1/3 of them coming from Southeast Asia. And Indonesia alone occupied nearly 10%. Today, we invited 9 experts from Taiwan to share their experience and research in the medical field, including the telemedicine consultation, craniofacial surgery, cardiovascular disease treatment, new treatment of leukoplakia, spinal treatment, high-end healthcare check, and all-in-one radiotherapy treatment. I believe that the mutual exchanges in the seminar will facilitate cooperation in the medical service and healthcare industry. Finally, thank you again for your participation. We wish all the distinguished guests good health and all the best. Thank you.
Thank you very much to Ms. Wu. Next, we would like to invite General Secretary of Indonesian Hospital Association, Dr. Lia Partakusuma, to share a few words with us. Let's now welcome Dr. Partakusuma.
Hello, my name is Lia Partakusuma. I'm a General Secretary of Indonesian Hospital Association. Distinguished guests, expo organizers, and participants, ladies and gentlemen, greetings from PERSI, the Indonesian Hospital Association. Let me first introduce our organization, PERSI. It consists of 18 member associations of different ownerships, which together have established 2,900 hospitals that deliver referral hospital care in the country. You may also notice from the country review that by distribution, the big number doesn't conceal discrepancies among Western and Eastern Indonesia and between Jawa, Bali, and the outer islands. In addition to that, we are still in pursuit towards higher standard of health technologies and tools, and more specialistic human resources for referral healthcare. PERSI is getting to know Taiwan healthcare through several opportunities, such as the annual Taiwan Expos, the visit of our leaders to Taiwan during the International Hospital Federation Conference, as well as the presence of the Director General of Taiwan Health Ministry at PERSI invitation to share the successful experience of Taiwan National Health Insurance in the PERSI National Congress. There are other things that have made the relationship more valuable towards the development of hospital care for both parties. We also learned from Taiwan's amazing success in managing the COVID-19 pandemic recently. I think we all agree that the pandemic has changed us to have more understanding that as the same Earth inhabitants, we must learn more and work together for better collaboration in achieving a healthy, safe, and peaceful life together in the coming future. It is in that context that we also welcome this year's Taiwan Expo, particularly in the light of PERSI efforts to grow and develop with the people in overcoming the challenges of patient safety, quality of referral care based on people's potential, and local culture. For this reason, we really appreciate the elements of quality, consideration of the needs of the people, and the respect to local culture, such as shown in the quality of Taiwanese health products, including halal food products at the Expo. As regards to our focus today, we have seen regulatory development that improve cooperation and trade experiences toward improvement of healthcare industry in Indonesia. I can also tell that nowadays, the status seems to be much better for more fruitful collaboration between parties. In the future, we hope for closer cooperation with mutual respect to overcome the challenges of hospital healthcare. We all strive for quality healthcare towards patient safety, quality healthcare with respect to people's culture. Let us grow and develop together to meet the needs of hospital care with the people in overcoming the COVID-19 pandemic nowadays and other challenges of health development that continue to grow into the future. We are proud to witness knowledgeable people are now involved in the healthcare industry with supportive-based regulation and wider areas for collaboration between parties. This is all to help together in making more even distribution of high-tech healthcare with qualified human resources. We know that collaboration will fulfill the challenges gap, and our government has made good progress towards realizing this. With that, we wish you every success in your endeavor. Thank you, Dr. Lia Partakusuma.
On to the presentations. Today we have two sessions, medical service and smart healthcare. During these sessions, you're welcome to submit your questions or comments by scanning the QR code shown at the bottom of the screen. We will be collecting questions and then invite our speakers to answer them at the Q&A session in the end. The first speaker today is Dr. Lu Chengkuo, Chief Medical Information Officer from National Taiwan University Hospital. Today, he will share with us about artificial intelligence-assisted bone marrow cell classification system. Please join me to welcome Dr. Guo.
Good afternoon, ladies and gentlemen. I'm Dr. Guo from the National Taiwan University Hospital. Today, I would like to introduce a system called AI-assisted bone marrow cell classification. I'm a physician of the Department of Internal Medicine, and I'm also the Chief Medical Information Officer of the IT Office and the Vice Director of the Center of Intelligent Healthcare. My hospital, the NTUH, is a public university-based tertiary medical center at Taipei It has a history of more than 125 years. It is one of the best hospital and medical college in Taiwan. We have one main hospital and 6 branch hospitals and 1 cancer center located all around Taiwan, as the map shows here. The bone marrow cell classification project was cooperated by the NTUH and the company Ether AI. This is a world's first AI microscope for bone marrow smear differential counting. About the Ether AI, it is a medical image AI company. It was founded in October 2015. It is dedicated to develop AI-powered medical image software. The headquarters is located at Taipei. As you may know, that bone marrow examination is very important for several blood diseases, including leukemia. A specialist, for example, a hematologist, physician, or a technician have to examine the slides of bone marrow smear. Like the picture shows here, they have to count the cells of each type. It is a time-consuming and a very time-consuming examination. There are 3 pain points in this procedure. First, lack of professional, because there are not many hematologists and technicians all around the world. The second, it is time-consuming. It can take up to 30 minutes per slide. And the third is that it is unable to verify because there is a high inter-operator variability of the examination. So we want to develop a system for the users, including hematologists and technologists. So we developed this system. This is a sample output of the system. The system could identify all the cells in the bone marrow smear and can recognize every cell types. During the machine learning training process, there are a large data set. More than 500,000 cells are annotated by our specialists, including the hematologist and the technician. And the result is already published in the American Society of Hematology. And we already developed a all-in-one solution system. Currently, there is only a release for RUO, that means research use only system. It has an average accuracy of 94%. So it is a very good accuracy rate. Currently, we are undergoing multi-center clinical validation trial within Taiwan and is pending for Taiwan FDA approval. So the strength point includes that the system could increase the consistency, and it could provide a high efficiency, and it is a single all-in-one solution. So the process is very easy. The user chooses the high power field of the microscope and then click detect, and then the system will detect all the cells and count all the cells. And then the physician or the technician have to confirm the summary and finish the report. This is a photo of the press conference of the NTUH and the Ether AI company. Finally, as you can see here, it is a simple all-in-one solution standalone machine. So you can very easily to introduce and incorporate into your lab system. And it is rather cheap. And so if you are interested in system, we may introduce you more in detail later. Thank you.
Thank you very much to Dr. Guo for your explicit introduction. For the next speaker, we would like to invite Dr. Ming-Nan Lin Vice Superintendent of Dalin Tzu Chi Hospital. He will be introducing to us the advanced medical technology with humanity care at Dalin Tzu Chi Hospital. Please welcome Dr. Lin.
Thank you, ladies and gentlemen. Good afternoon. For friends from Indonesia, apa kabar? So it's really my honor to introduce you our advanced medical technology with humanity care at our hospital. And I'll brief introduce Tzu Chi Foundation. Tzu Chi Foundation was established 54 years ago, and we have 4 major missions. First up from charity, and then medical care, and we also have education missions with 2 universities and high school, even kindergarten, and also a humanity mission. And then how did Tzu Chi Charity Foundation start its medical mission is because that our Dharma Master Cheng Yan came to realize that many people become poor due to diseases. So she thinks that if we want to end poverty, illness should be treated. So therefore, in the year 1972, Tzu Chi Foundation set up a free clinic in Hualien. It is in eastern part of Taiwan, and provide free medical services to poor twice a week. And then until the year 1986, we start our first Tzu Chi hospital in eastern part of Taiwan. And since then, there are now 7 hospitals around Taiwan. And Dalin Tzu Chi Hospital started in the year 2000. So we are now 20 years old. Compared with Taipei, we are quite young. But now we also have a Tzu Chi hospital in Indonesia, in Jakarta. It will be open until next year in Jakarta. And then this is our hospital. We are first Tzu Chi hospital in western part of Taiwan. And then we are a regional teaching hospital. Our total bed is 931 with acute bed around 600. And then total, we have around 2,000 staffs private care in southern part of Taiwan, which is located in quite rural area. And then we have, although we are located in quite rural area in southern part of Taiwan, but we also provide high-tech medical services. Like we have hybrid OR, and then we can do transcatheter aortic valve implantation. And we also, for radio oncologists, we have true beams. And then for knee joint surgery, our Professor Liu, he developed a knee joint health promotion option. Later on, I was introduced to you. And for vitiligo dyschromia, there is some new treatment modality. And for spinal diseases, minimal invasive spinal diseases started more than 10 years ago in our hospital. And then I will briefly introduce 3 treatment modality for you. The first one is vitiligo. It is called dyschromia. And we have our superintendent, Professor Lai. He is an expert in treating vitiligo. Vitiligo is diseases with unknown etiology. It is immunological diseases. And although it is not fatal, but it will cause the patient depression because of the change of the experience. And then our superintendent, Professor Lai, developed a treatment modality that more than 20,000 patients have been treated. And then 35% patients show significant pigment regeneration within the first 6 months of treatment. And then there's few side effects, such as a decrease of white blood cell, nausea, and liver dysfunction is less than 0.2%. And then the patient satisfaction rate was 90% and 97% in 1 year and 6 years, respectively. And the second treatment modality I want to share with you is the minimal invasive spinal surgery. We studied more than 10 years ago, and then hundreds of cases with spinal disease like spinal tumor, deformity, herniation of disc, fracture of vertebra has been successfully treated in our hospitals. And then besides that, some neurologic disease, this is our Vice Superintendent, Dr. Cheng. And then this case is from Malaysia. He has meningioma more than 6 centimeter. And then in Malaysia, they say that it is not possible to operate it. So he was recommended by our CHC volunteer in Malaysia, came to Taiwan to our hospitals. And then this is in the year 2019, and we start surgery. And then besides successfully operate the patient, then we also follow up the patient in Malaysia. So now, as you can see, in June, he became very active. And the third treatment modality is the knee health promotion option. Dr. Li Shaozui, he find we call medial abrasion phenomenon as the pathogenesis of knee osteoarthritis. It's quite prevalent in old patients. And then it is a total solution for knee osteoarthritis. And he published more than 10 papers in renowned medical journals. And there is a procedure called ACRFP, arthroscopic cartilage regeneration facilitation procedures. After if this is the patient was diagnosed with knee OA, and then according to the X-ray or MRI, there are different stages. So we use different modality to treat the disease, and then we can also even find that the cartilage will regenerate. So we don't need to have like for a stage 5 diseases, total knee arthroplasty, total knee replacement. As you can see, this is before KHPO. You can see the stage 3 to 4 knee joint OA, but after 3 years of the procedures, and the cartilage regenerated. And there, every year there are more than 500 patients being operated successfully in our hospital. This is my talk. Thank you. Introduce our CHC Hospital. Thank you.
固定我看一下哦，真的都上面都变形了，以后就近端关节会慢慢变，大家都要全力来对抗这个疫情。
Thank you once again to Dr. Lin for the introduction from Dalin Tzu Chi Hospital. Moving on, we would like to invite Dr. Nina Gao, CEO of Overseas Medical Mission Center from Changhua Christian Hospital. She will be introducing to us the smart healthcare and international medical service that Changhua Christian Hospital offers. Please welcome Dr. Gao.
Salaman Sien. Good afternoon for our brothers and sisters in Indonesia. I'm Nina from the Changhua Christian Hospital. It's my great honor to have the opportunity to introduce Changhua Christian Hospital. So who we are? Actually, Changhua Christian Hospital was founded in 1896. So now the hospital is already 124 years. But now the hospital is the biggest healthcare center in the center of Taiwan with 9 branches and over 4,000 beds. And we also have that's the first in green and smart hospital in central of Taiwan, so which is a Yuan Christian Hospital. So we have very professional knowledge and technology in smart hospital design, construction, and management consultation as well. So the hospital's core value is share. So the share is means speech care in the strategic alliance. We try to mobilize resources, and we do the knowledge education as well. So this is our locations. We are now in Taipei. We're in Changhua. Cover that the Taichung, Changhua, Yuanning, and Nantou area. So all of the branch hospitals around that in the central area. So the hospital we also recognize with many of accreditation in national and in the international. So the hospital already passed the JCI in 2008, and every 4 years we apply the JCI, and we also pass the JCI accreditation. So we also have the CCPC accreditation as well, and the hospital also passed like the FRIP-CAP and AHOP for the clinical trial. So this is our emphasis on the medical service. We emphasize on comprehensive medical care model, including the whole person, whole family, whole team, whole process, and whole community. So the hospitals work with strong parts. The first one is in healthcare management. So the hospitals and center, and health checkup center, we recognize by the Commonwealth magazine as the best service organizations. So we got the gold award. So if we like to search that for the good and health checkup, we welcome to visit our hospital. The other one, that's the cancer patients care. We provide a holistic care for the cancer patient, including that pre-screening, early screening, diagnosis, treatment, until the end of lives. The hospital, we also have very strong part in the transplant, the team, including kidney transplant and the liver transplant. The survival rate over within the 5 years and almost near the 80%. We also have very strong part in the IVF, the infertilization treatment. This is almost the top in the Taiwan, maybe that's the top also in the Asia. So the live birth rate over the 45%. And we also have very good the laboratory to storage as egg and sperm. That's the laboratory also accredited by the CAP USA. So every year over 1,500 couples to visit Changhua Christian Hospital to search the IVF treatment. The IVF treatment also working with the innovative genetic medicine. So we have the pattern for the diagnosis of prenatal and screening. So we use that technology can be early screening and diagnosis for the rare diseases, cases. We have that one branches, we call it Yuan Christian Hospital. The hospital from design, construction, and operation, they integrate the IO system and AI system into the system. So the hospital provide like the total solution, like in the medical cares. So for this system, we're working with a Taiwan very strong company to work together to transform the very good idea into the hospital's management. For example, like in the COVID-19 in the COVID-19 period, so we apply the technology into the COVID-19 prevention, including the biocare to do like the discontamination of the patient ward, and we also do like the endotubing and the robot to do the disinfection as well. So what we can provide, we provide that top managers and study tour, so we can take them to visit the smart hospital. We also can provide that the some of the very good of the Taiwan very outstanding of companies if our the guests they would like to search some of cooperation. We also provide that there's a very professional training that depends on the needs, so that we can provide from 1 month to 6 months till the 1 year training. And we also can provide like a management consultation, including accreditation, safe quality, safe service, and the other one like the performance management as well. And we also do like the patient referral service, including the online service, and also the international patient referral service. So welcome to Changhua Christian Hospital, and we look forward to working with you together. Thank you.
Thank you very much to Dr. Gao. And that was the introduction from Changhua Christian Hospital. Next, we will look into the topic of preventive health checkup. The speaker is Dr. Liang Kwang Chen, Chief of Diagnostic Imaging Department from Xinguang Wuhousu Memorial Hospital. Please welcome Dr. Chen.
Selamat siang. Saya Dr. Chen Liang Kwang dari Rumah Sakit Xinguang Memorial Hospital Medical Center di Taipei, Taiwan. Sebagai tren untuk kesehatan masa kini, yakni kita harus mewujudkan kesempatan rangkul kesehatan, wujudkan gaya hidup sehat. Sebagai begitu, kita harus mengertikan untuk kesehatan kita, pertama teknologi dan pusat medis. Rumah sakit Xinguang Hospital tingkat pusat medis. Berbagai tim dokter profesional yang lengkap dan penjelasan konsultasi dengan dokter senior. Kedua, itulah kita harus mengerti. Waktu kita ada penyakit itu harus perlengkapan dan peralatan yang eksekutif. Peralatan medis berteknologi tinggi yang komprehensif. Ada lingkungan periksa yang independen dengan periksa yang medis terpisah. Fasilitas satu lokasi untuk periksa penyakit utama. Ketiga, kalau ada periksaan yang terjadi, layanan medis lanjutan yang lengkap. Penanganan segera saat kondisi abnormal dan perawatan rutin oleh tenaga kesehatan yang terlatih. Udah itu konsultasi dengan dokter spesialis dengan diatur segera. Sehingga kalau ada kesehatan yang terjadi waktu periksaan itu kita harus hati-hati. Apalagi kita setiap orang harus perhatikan kesehatan semua. Sehingga di sini saya sekali mengatakan bersamalah kita perhatikan kesehatan. Dan harus kalau ada waktu kita dapat ke Taiwan, jumpa kita di Taipei. Di sini saya mengucapkan terima kasih. CHC, thank you very much.
Thank you very much to Dr. Chen. Thank you. And moving on, we have Dr. Jiawei Lin, Director of International Healthcare Center from Taipei Medical University, to introduce the healthcare system and feature services that they offer. Please welcome Dr. Lin.
Good afternoon, ladies and gentlemen. I'm Dr. Lin from International Health Center of Taipei Medical University. Today, I would like to introduce our healthcare system and our special feature. Taipei Medical University was founded in 1960. Our core values are humanity, integrity, innovation, collaboration, and service. Based on this core value, we focused our medical education in the past 60 years. We have been educating many outstanding alumni, including 3 Ministers of Health and Welfare in Taiwan. In our system, now there are 6 affiliation hospitals. Today, I would like to introduce the first 3. The first one is Taipei Medical University Hospital, and the second one is the Taipei Municipal Wanfang Hospital. The third one is the Shuanghe Hospital. And then I would like to hand over my presentation to Professor Cheng. He is the Director of Craniofacial Center from First Affiliation Hospital of Taipei Medical University. Professor.
Thank you. Good afternoon, ladies and gentlemen. I'm working in the Taipei Medical University Hospital. And our hospital is located in the center of Taipei, and which is only 5 minutes walk from the Taipei 101 building. And our hospital is a leading smart hospital in Taiwan, and they have passed 4 times of the JCI accreditation. And we have 8 centers of excellence in our hospital. And the Javico company is our partner in Indonesia. My center, the Craniofacial Center in Taipei Medical University Hospital, is the 3rd one in Taiwan, which is the youngest one. However, we provide the most comprehensive multidisciplinary care among Taiwan. And we are also focused on the patient-centered and family-centered total patient care. And these are the multidisciplinary care we can provide in our hospital. And we are managing these deformities like the cleft lip and palate and the hemifacial microsomia, or some deformity called the cranial synostosis, or some severe benign tumors in the head and neck region. And these are some examples of our lip repair in unilaterals. And these results are from the deformities in the upper tooth. And the lower tooth are the result of our nasal reconstruction, the long-term results 9 years after 1-stage nose repair. And these are the examples of our repairs in bilateral cleft lip and palate. And these are from the deformity like the upper ones, and the lower one are the long-term results of our nasal reconstruction. And this is a deformity called the cranial synostosis. You can see the asymmetric eyes and the forehead. And the patient had only 1 surgery, and this is 12 years after the first reconstruction. And this is a special disease called the Crouzon syndrome. Patient has very protruding eyes, very retruding midface, and very protruding lower face. And we can change her face from here to here, and even to here. And personally, I have done 420 international presentations, 155 peer-reviewed articles, 22 book chapters, and 5 teaching videos, and won 4 Best Paper Awards in the past 20 years. And I did 11 overseas surgical demonstrations in these countries, 16 overseas club missions in these countries. And these are some of the humanitarian works I did in Taiwan. These are all overseas patients, like the very severe facial clefts in the right upper, a disease called meningomyelocele in the middle, and a disease called a frontal nasal encephalocele in the lower part, and neurofibromatosis in the lower part. In the past 23 years, I have trained 32 fellows from 17 countries. 5 among them were trained in Taipei Medical University in the last 3 years. And these are some of the fellows and visitors. And for overseas non-charity patients, in the last 28 months, we have over 200 patients, like the lip and palate and cranial synostosis. These patients are coming from these countries, and some of them are even coming from Australia, United States, and Canada. And these are some of the results of my non-charity patients. The smile of these patients and the smile of their parents are the biggest reward to us. I thank you for your attention. Next, I will present my colleague, Dr. Chen Yubing, from the Wanfang Hospital of our system.
Good afternoon. I'm Dr. Chen Yubing. I'm the attending physician of our orthopedic and also a deputy director of our business development department and also International Medical Center. Okay, I'm very happy to stand here to introduce my hospital. And Wanfang Hospital is one of the medical centers located in southern part of Taipei City. And we have specialized in geriatric medicine, and also community medicine, and evidence medicine, cancer therapy, and also e-health. And we have 431 doctors, and we offer 743 beds in hospital care. And also, we can serve 1.5 million patients in our daily clinic. And was mentioned, our hospital is the only hospital which was certified by JCI for 5 times in Taiwan. So offering high quality of care is the main goal in our daily practice. As an orthopedic doctor, and also on behalf of my shoulder arthroscopic team, I may want to introduce the Professor Dr. Zhang Taiyuan. And Dr. Zhang, who is the leader of our shoulder arthroscopic team, is trained by the Dr. Stephen Berha. And Stephen Berha is one of the 3 pioneers of the arthroscopic surgery, shoulder surgeon worldwide. And Dr. Zhang, he had already performed over 103,000 cases in our hospital and has very high surgical successful rate and also patient certification. And also, compared with a conventional open surgery, arthroscopic shoulder arthroscopic surgery can offer rapid recovery and also have a shorter hospital stay. So we are very welcome for your coming, and also we look forward to your further consultation. This is my presentation. Now we introduce Dr.
Good afternoon, everyone. My name is Min-Chin Lin. I'm the Director of AI and Robotic Surgery in the Neurosurgery Department at Changhua Hospital at Taipei Medical University. And Changhua Hospital is one of the affiliate hospitals of Taipei Medical University, which is also the latest and the largest one. In Changhua Hospital, we provide 1.7 million OPD per year, and we have more than 1,500 beds in Changhua Hospital and around 600 physicians in Changhua Hospital. In Changhua Hospital, we provide the most advanced complex treatment, such as for the cancer treatment, we have PET CT, and we have gamma knife, and we have tomotherapy. We can treat different kind of cancer treatment. And we also have the Taipei Neuroscience Center. We just purchased the focused ultrasound, which can treat the essential tremor, and we also have the robotic arm spine for the spine surgery. And also the minimally invasive surgery, we have also the Da Vinci robotic arm and the laparoscopic surgery and different kind of knee replacement surgery. Here, I want to give you an example. It's called the ROSA spine surgery. We know the spine surgery is one of challenging surgery in the aging society. In order to put the screw into the patient's body, it requires many years' experience. So in Changhua Hospital, the ROSA spine is led by Vice President Cheng Lin, who is also a pioneer all over the world. About 2 years ago, we purchased our first one, ROSA spine, which also the third spine surgery robotic arm in all over the world. So with the help of the ROSA spine robotic arm, we can perform a safety and a very accurate spine surgery. And compared to the traditional spine surgery, which by using the ROSA, we can create a small wound and save more time and let the patient out of the hospital more efficiently. And currently, we are creating our spine training center. We are hoping in the future we can have more conversation with Indonesia to share the spine surgery experience. Thank you.
Okay. I think the above presentation all are focused on patient treatment and the patient referral. Actually, for our international medicine service, we provide not only the healthcare referral, we also provide the hospital management, certification, consultation, and the personnel training. For the hospital management and operation, we cooperate with more than 100 hospitals in the past year. For the certification and the consultation, for these 3 major hospitals, we passed 15 times JCI accreditation. So we have a lot of experience. So we help more than 13 hospitals to pass the JCI accreditation. And for the personnel training in the past year, we host more than 1,000 visitors. And then we also accept more than 500 specialty to have advanced program training in our hospital, in our system. And then we provide the one-stop service for the patient referral. We provide the pre-arrival consultation and the admission, and then to the discharge and the follow-up. Actually, this is all we can provide in the Taipei Medical University healthcare system. So we hope we can have the opportunity to cooperation and share our experience. Thank you.
Thank you very much to Dr. Lin. Thank you. And to all the doctors who participated in this presentation. The next speaker is Ms. Eva Cheng, Secretary of International Medical Center from National Cheng University Hospital. She will be presenting to us about the special features and services of National Cheng University Hospital. Let's now welcome Ms. Cheng.
Hello everyone, I'm Eva Cheng from National Cheng University Hospital. It's my pleasure to be here during this event and give the presentation of my hospital. Our hospital is in Tainan City, which used to be the capital city of Taiwan. And it's around like 100 kilometers away. We also have a branch hospital in Dalin City, central Taiwan. Because we are a university hospital, so I need to trace back the history back to 1931. That is our school that is first established as an engineer college. And the school system transformed into a university and has the name Cheng in 1956. Our hospital is officially open to the public in 1988. After 5 years, we have our College of Medicine. This is the map of our medical center. We have 2 main buildings. One is the outpatient building and one is the inpatient building, connected with the Sky Bridge. And next to the inpatient building, we have our College of Medicine. And what I want to remark that is behind the outpatient building, we have the National Health Research Institute. There are only 2 in Taiwan. One is just next to the outpatient building in our hospital, and the other one that is in Taipei City. With the core value, life, love, excellence, and creativity, we not only provide excellent medical services to the public, offer teaching and research to the medical personnel, we also uphold social responsibilities. We have more than 5,000 staff in our hospital. Half of them are doctors and nurses. And we also have 1,354 beds. And over 70% there are acute beds. About the nurse-to-patient care ratios, we know that is a very important index to the health care qualities. And compared with the ideal number 1 to 6, our hospital in 2019, the number that is 7.2, and we are also still working on hard to reach the global standard. We have a lot of cutting-edge devices in our hospital. such as like the Dalin Tzu surgical system, hybrid operation room, IGRT for the cancer treatment, PET-CT for the early stage early age testing, and also 2 6 CT scans. And we have a lot of the multidisciplinary teams, such as like organ donation transplantation team, ART, stroke care center, diabetes prevention center, Alzheimer's disease research center, and sleep medicine center, and a lot exactly. And what I want to mention that is about the organ donation transplantation team, because in our hospital we have our own organ bank, and we can perform the ABO incompatible transplantation. And what is remarkable that is in our hospital, we have the best heart survival rate on the heart transplantation. Also, our hospital is working hard on the precision medicine and the e-health, especially the AI, because in this year, due to the COVID-19 pandemic, and our hospital performed a lot of measures that is based on the AI system. This is the international collaboration map of our hospital. So now our government is promoting the new Science Fund policy, but our collaboration history can early trace back in 2008. And we just collaborate with the Kenya, India, Vietnam, Nepal, Myanmar, and Indonesia through like co-host international conference and exchange personnel. That is about our hospital. Thank you very much.
Thank you very much to Ms. Chen for the introduction. Moving on to the second session, where the main topic is smart healthcare. The first speaker is Mr. Iranius Ezra Tiradi, Strategic Development Specialist at CHC Healthcare Group. He will share with us the product and service overview for Indonesian market. Please now welcome Mr. Tiradi.
Perkenalkan, nama saya Iranius Ezra. Saat ini saya bekerja sebagai Strategic Development Specialist di CHC Healthcare Group. Nah, saya ingin perkenalkan sedikit tentang perusahaan kita. Perusahaan kita didirikan di tahun 1977, jadi kurang lebih tahun ini udah mencapai umur yang tidak muda, ya kurang lebih 40-an tahun. Ya. Nah, di awalnya perusahaan kita hanya bermain di bidang radiasi onkologi. Kemudian saat ini udah berkembang hingga 5 cabang lainnya. Ada neuroscience, radiasi onkologi, medical imaging, ophthalmology, dan surgery. Nah, ada kesamaan dari 5 bidang ini, yaitu kita bermain di bidang healthcare yang lebih spesifik di bidang teknologi. Begitu. Nah, untuk aktivitas bisnis kita ada 3. Yang pertama investment, direct selling, dan service. Nah, nanti saya akan jelaskan juga di slide selanjutnya. Nah, yang pertama itu di bidang investment. Saat ini udah ada berbagai macam rumah sakit di Taiwan yang udah bekerja sama dengan kita, khususnya di bidang radioterapi. Nah, di sini kita bisa lihat ada National Taiwan University yang setara seperti RSCM-nya Indonesia. Kemudian ada Tri Service General Hospital juga yang juga menjadi partner kita, yaitu seperti RSPAD-nya Indonesia. Nah, di sini kita juga ada rumah sakit yang kita akuisisi sendiri, yang saat ini juga menjadi rumah sakit di bawah manajemen kita, yaitu Iren General Hospital. Nah, Iren General Hospital ini ingin kita jadikan sebagai smart hospital. Jadi semuanya udah terintegrasi, mulai dari paperless, kemudian kita juga ada ingin meminimalisir antrian di rumah sakit, jadi semuanya istilahnya mulai dicoba untuk goes online begitu. Nah, untuk Bapak Ibu yang sedang main ke Taiwan boleh hubungi saya. Nanti kita bisa aturkan untuk istilahnya tour rumah sakit begitu. Kita perkenalkan bagaimana sih environment-nya di Iren General Hospital. Kebetulan kita bekerja sama juga dengan perusahaan manufaktur di Taiwan yaitu Advantech. Nah, untuk investment ini sendiri kurang lebih untuk satu rumah sakitnya kita total valuasinya mulai dari 3 juta US dollar. Nah, jadi tiap investasi di satu rumah sakit kurang lebih minimal ada 3 juta US dollar gitu untuk nilai investasinya. Nah, untuk penjualan produk sendiri kita ada berbagai partner juga dari seluruh negara. Nah, terutama ada dari Eropa dan Amerika juga. Ada untuk radiasi onkologi yang kita spesialnya di situ, kita ada partner kita Elekta dan IBA. Kemudian yang seperti yang tadi saya udah bilang, ada Advantech juga, perusahaan dari Taiwan, dan ada lain sebagainya. Ada GE juga, dan lain sebagainya. Jadi di sini kita bukan sebagai manufaktur, tapi kita sebagai distributor juga sebenarnya. Nah, cuman kita juga akhir-akhir ini ada mulai mengakuisisi perusahaan manufaktur, seperti contohnya Swiss Re ini. Nah, kita akuisisi karena kita juga ingin mencoba apakah kita bisa mulai memproduksi barang sendiri. Gitu. Nah, kemudian untuk service di bidang radioterapi, kita ada mulai istilahnya one-stop solution. Nah, karena kita udah lama sekali bermain di bidang radioterapi, untuk saat ini adalah expertise yang kita paling jago, bisa dibilang begitu. Dari awal construction planning, perhitungan bunker, agar radiasi itu tidak keluar. Jadi hanya berada di tempat treatment. Kemudian regulasi, biasanya untuk kepengurusan izin yang cukup lama, apalagi di Indonesia birokrasinya cukup rumit. Kemudian ada lagi instalasi mesin. Nah, instalasi mesin ini cukup kompleks. Biasanya perlu waktu 30-60 hari malah. Kemudian ada perawatan mesin. Nah, jadi dari awal hingga akhir kita bisa mengurus. Nah, itu untuk operasional bisnis kita yang ada di Taiwan. Nah, untuk yang overseas sendiri, kita udah punya cabang di 2 negara. Pertama di China, kedua di Indonesia. Nah, untuk di Indonesia, kita ada bisnis partner yaitu Mayapada Hospital untuk saat ini. Nah, tapi kita masih terbuka juga untuk bisnis-bisnis partner lainnya. Nah, apa yang sudah kita kerjakan? Nah, untuk di rumah sakit Mayapada sendiri, kita ada investment, seperti yang sebelumnya saya bilang. Nah, investment ini sendiri kita taruh alat yang namanya linear accelerator. Nah, untuk investment di bidang lainnya, tapi masih dalam bidang healthcare, kita juga terbuka, boleh hubungi kita juga. Kemudian kita ada radiotherapy establishment, karena kita udah ada pengalaman lama di bidang ini, kita bisa konsultasi dan lain sebagainya di bidang radioterapi. Kita biasa sebagai konsultan untuk perhitungan bunker, untuk keamanannya, dan kemudian untuk flow pasien, untuk pemetaan apakah di radioterapi ini ada ruang treatment, ada ruang konsultasi dengan dokter, dan lain sebagainya. Kita untuk peletakannya pun sampai sedetil itu kita bisa lakukan. Kemudian ada radioterapi training. Biasa kita dengan partner kita di Indonesia dan partner kita di Taiwan, kita bisa saling menghubungkan. Jadi untuk ini sendiri seperti yang ada di foto ini, kita membawa praktisi, yaitu Rumah Sakit Mayapada Hospital, kita bawa ke Taiwan di Three Service General Hospital, ya, yang tadi saya sudah bilang seperti RSPAD-nya di Indonesia. Gitu. Nah, kemudian ada service juga, mulai dari instalasi mesin dan perawatan. Nah, di Indonesia, kita saat ini udah melakukan investment dan service. Nah, untuk direct selling sendiri kita belum melakukan, karena kita sedang mencari juga partner yang tepat di Indonesia, yang bisa bertumbuh bersama dengan kita. Nah, dari situ nanti kita bisa belajar lagi. Nah, jadi saat ini kita juga looking for business partner dan kesempatan. Bahkan kalau misalkan kita ada kesempatan untuk bertumbuh bersama, kita belajar bersama, kita juga rela untuk memasukkan dana juga untuk membangun perusahaan yang cukup besar di Indonesia. Terima kasih, ini bisnis detail dan kontak saya. Boleh dicatat, boleh hubungi saya. Kalau main ke Taiwan juga boleh kabarin kami. Nanti kami bisa ada teman-teman juga yang mungkin membawa untuk memutar di rumah sakit tempat kita kerjasama, atau bagaimana smart healthcare itu kita juga buat di Iren, di rumah sakit yang udah kita akuisisi. Gitu. Terima kasih.
Thank you very much to the presentation from Mr. Tirati. Last but not least, we have Mr. Scott Wang, Product Deputy Director from Octon International, to share with us on the topic of medical communication solution. Please welcome Mr. Wang.
Good afternoon, ladies and gentlemen. I'm Scott Wang from Octon International. It's an honor that I will take this opportunity to introduce our medical communication solutions developed by Octon International. Octon has been in communication system solution provider for 20 years, and we use that technology, expertise, and knowledge to develop a system, a platform for medical solutions. And everything is built on communications. In Octon, we take data security and privacy seriously. So all the transmission data, information, even the data stream of video and audio has been strongly encrypted to ensure all the information transmitted over the internet is secured. We provide various ways of communications, messagings, collaborations, groups, audio, videos, and not the least, video conference for multiple groups or video streaming for further education purpose. Okay. As a communication platform, we collect data. And at this point, we collect multiple medical data throughout the process. So we also have these sort of features to ensure data collected and sharing is capable and secured. But not the least, in recent days, all the information technology has been greatly using latest technologies such as international medical devices, and we also integrate that to speed up the data collections and responsiveness of all the medical services. Okay. So as I spoke earlier, data security is the one most important things. So we build our system as a secure system. Everything stored, transmitted, or even the messages are encrypted in every single transmissions. And data stored is also encrypted physically in our disk storage. But we're also capable of leaving zero footprint of data collected if needed. The system is flexible. It built on as idea of web services, so we will be able to integrate our services or extend our features using web APIs, or even we are able to customize our features to incorporate with a traditional or proprietary system if demanded. And with the data collected, as Dr. Liu has been introduced their AI solutions, those information will be shared through necessary systems and for further evaluations or further analysis. So we have integration capability as well. But we built this system in aim to become a social media platform for medical solutions. So we're bridging all the medical resources together and build a society on top of that. Okay. The system is using edge computing architectures. So with this edge computing, whoever using the system can have full operation and full control of the system. They can build it within their own network environments. So the high security possible, measurement possible can be reached. As I say, it is a communication, but also a social media as a days. Now we're using messagings, videos, audios, and we're bridging all those medical services from patient, hospitals, pharmaceuticals, even home healthcare services we bring them all together. They can chat and share the message and knowledge or services within the same platform. Let me introduce a bit of scenarios that we can utilize our platform. First is a traditional way of using it, telemedicine. So you'll be using a mobile devices to connect, to reach your doctors or share your medical records on the go. Second, as tourism medical services has been very popular these days, reaching or provide your medical solution, not just domestic, but internationally, is one of the hospital aim focus as well, as we have seen in previous presentations. So with this system, you will be able to reach patients, or patient can reach doctors or seeking medical services overseas. And those are instant feedback you can get and receive from doctors right away. Medical services from beginning, but we are looking at the post, the after services when you have received your medical treatments. So with the system, you will be using a wearable devices constantly monitored your health, your heart rates, and everything, and share this information to our services systems with a specialist. We can provide online solutions or online advice right away. Or if there is necessary, if there's any emergency, this system can also trigger the warning system, notify appropriate organizations or emergency response team to assist. Okay. Again, those previous scenarios we're talking on patient and doctor and medical services, but this platform is also can be used to education, to share the knowledge between doctors, or hosting a seminar or training sessions to trainers, or even share these medical surgical procedures through the world. Of course, these are just some scenarios that we had provided and has been utilized in Taiwan. And there are more. Building a network, which forming a community. Within the community, we will be able to share the knowledge, share the services. And on top of all, we can increase the efficiency of medical care within the hospitals. For instance, an elderly person will not need to go to one clinic or one station to another. They can have their own examinations, all examinations taken one spot. And this information will be shared to all the necessary or the specialist. All right? And they can join together and provide a consultation or discuss in front of the patient, or the patient, even the patient is overseas. Okay, and that will be all for this presentation. Thank you very much.
Thank you very much to Mr. Wang for the introduction of Octon International and also sharing with us on the future trend of medical communication. Ladies and gentlemen, so far we have heard 8 presentations from the experts in Taiwan medical and healthcare industry. Moving on to the Q&A session. Due to our time constraint, our staff have selected a few questions that we would answer here. The others will be answered online after the event. Please allow me to read out these questions first, and then we will invite our speakers to answer them. So the first question we have is for National Taiwan University Hospital. And the question is, what can Indonesia and Taiwan do to further enhance collaboration in the field of AI bone marrow cell classification? Dr. Guo, would you answer for us?
Yes, I would like to answer this question in 2 parts. First, if you are interested in this product in your hospital, I think it's easy to bring this small device into your lab. So it is very easy. And the second part is about from the viewpoint of the nationwide implementation. I think because currently it is only a research use only product. So if you want to make it a commercialized product, I think you should follow the FDA of your country. So I think in Taiwan, currently we are ongoing the FDA approval process. So I think you can see your regulations and then apply for the FDA approval in your country. Thank you.
Thank you very much to Dr. Guo. The next question is for Taipei Medical University Hospital. I think it's for Dr. Philip Chen, because this question is about craniofacial surgery. Dr. Chen, you showed us a lot of amazing photos of your patients in your presentation. And one of our audience would like to know, what is the hardest, the most difficult craniofacial surgery case that you have ever done?
Actually, all the cases I shown in my presentation are very, very difficult. Those humanitarian cases came to Taiwan. All of them are unique ones. And almost everyone we have written into a medical article or did some international presentations. So everyone is unforgettable.
Thank you very much, Dr. Chen, and thank you for all the wonderful work that you do. The next question is for Octon International. And the question is, has Octon established any cooperative relationship with hospitals in Indonesia so far? Mr. Wang?
Thank you. So far, no, unfortunately, but our solution has been adapted and used in 2 hospitals in Taiwan. One is Cheng Memorial, and another one is Veteran General Hospitals. And we have been, for over 2 years, we have been actively participating in any internationally exposed to introduce our solutions. Even we have went to Vietnam. But unfortunately, we were planning to go to Indonesia this year. Because of the pandemic, this trip is not happening. But with this opportunity, I would like to take this opportunity as a beginning of all the great relationship we may have with Indonesian partners. Thank you very much.
Thank you very much to Mr. Wang. And thank you once again to all our speakers for sharing with us today. Ladies and gentlemen, this concludes the webinar today. Thank you very much for joining in. We hope through today's presentations, you would have a better understanding on the latest medical innovation and healthcare solutions in Taiwan. Please help us fill out a survey by scanning the QR code on the screen. We would like to hear your suggestions and feedback for future events. Thank you once again for watching. We wish you good health and all the success in your future endeavors. Thank you.